Exercise for chronic shoulder pain. Please consult your primary care provider or physical therapist before starting an exercise program. This video is designed to help you perform the correct technique of exercises that have been given to you by your healthcare professional. This strengthening and stretching program is designed to increase your strength and flexibility so that you can perform more activities you enjoy with less effort. Choose a time of day that best fits your daily routine. Please contact your primary care provider or physical therapist if you have questions or concerns. Prone shoulder lift, 3 positions. Begin by lying face down on a bed or a mat on the floor. Place a pillow under your hips and a rolled towel under your forehead. This exercise has 3 different positions for your arms, going from easiest to hardest. You may need to begin with 2 to 3 repetitions and gradually build up your strength. With each position, do as many repetitions as you can, with a goal of 10 repetitions for 3 sets, 3 to 5 times a week. For each exercise, squeeze your shoulder blades together as if they will be touching, and then lift your arms. Be sure to breathe normally as you complete the exercise. Position 1. Begin with your hands by your hips. Squeeze your shoulder blades together and lift your arms off the floor, mat, or bed 2 to 4 inches. Slowly return to the starting position and relax your shoulder blades. Position 2. Begin with your arms out to the side as if you were an airplane. Squeeze your shoulder blades together and lift your arms 2 to 4 inches off the floor or mat. Slowly lower to the start position, and then relax your shoulder blades. Position 3. Begin with your hands forward like Superman. You may need to bring your arms out to a diagonal to complete the exercise. Squeeze your shoulder blades together and lift your arms 2 to 4 inches off the floor or mat. Slowly lower to the start position and then relax your shoulder blades. Common error: lifting your arms and then squeezing your shoulder blades. Tightening your buttocks and legs during the exercise. Holding your breath. Squeeze your shoulder blades first and then lift your arms. Be careful not to arch your back when lifting. If needed, use a second pillow under your hips. This can be a challenging exercise. Be sure to breathe during the exercise. Shoulder external rotation. Begin this exercise lying on your side, on a bed or a mat on the floor. Support your head with a pillow or your hand, and support your arm with the towel under your arm. Bend your elbow and lift your hand toward the ceiling and slowly return to the starting position. Begin with no weight and progress to a light weight as you get stronger. Be sure to keep your elbow bent to 90 degrees and breathe normally as you complete the exercise. Repeat this for 10 repetitions for 3 sets, 3 to 5 times per week. Common error: lifting your arm off the towel, arching your neck or back with the exercise. Keep your arm resting on the towel to help your shoulders stay in line with your body. Be sure to keep your neck and trunk in line when you're doing the exercise. Wall push-up. Stand 15 to 20 inches from a wall with feet hip distance apart. Place your hands on the wall at shoulder height with your elbows slightly bent. Tighten your abdominal muscles to support your back and spine. Inhale and slowly bend your elbows and bring your chest closer to the wall. Exhale and slowly push away from the wall until your elbows are straight. Repeat for 3 sets of 10 repetitions, 3 to 5 times a week. Common errors: standing too close or too far from the wall. Don't stand too far away from the wall. You will feel your heels come off the floor. When you stand too close to the wall, you may arch your back. Shoulder scaption. With your thumb pointed up, lift your arms up at a 45-degree angle from your body so your arms are in between straight forward and out to the side. Raise your arm to shoulder height, keeping your thumb pointed toward the ceiling. Slowly return to the starting position. Lift and lower slowly and in control. You can do both arms at the same time and use a hand weight or band for resistance as you get stronger. Be sure to breathe normally as you complete the exercise. You may also do one arm at a time. Repeat this exercise for 10 repetitions for 3 sets, 3 to 5 times a week. Common error: lifting over shoulder height. Arching your back or neck during the exercise. Lifting with your palm up or down. Protect your shoulder joint by only lifting to shoulder height. Be sure not to arch your low back when raising your arm. Be sure to lift with your thumb pointed to the ceiling. Pec stretch, 3 positions. Stand in a doorway and place your hands out to each side of the doorway. For each of the 3 arm positions, take a small step forward into the doorway until a mild stretch is felt in the front of your shoulders or chest. Breathe normally and hold the stretch for 30 seconds and repeat 3 times. Keep your abdominal muscles tight so you do not arch your back. Repeat this stretch for all 3 hand positions. This stretch may be done daily. Position 1. Hands at hip level, palms flat to the doorway. Position 2. Hands at shoulder level with elbows bent. Position 3. Hands above your shoulders with elbows slightly bent. Common errors: leading with your head during the stretch, arching your back during the exercise. Keep your head in line with your body. Don't let your chin come forward or hang on your arms. Tighten your abdominals and your pelvis in line with your shoulders. Upper back stretch. Begin this exercise in standing or sitting. Lace your fingers together, palms facing each other in front of you. Look down at your hands and reach forward until a gentle stretch is felt in your upper back. Breathe normally and hold the stretch for 30 seconds and return to the starting position. Repeat 3 times and complete daily. Common error: bending forward too much. Don't bend forward at the waist when you do this stretch. Only reach forward to stretch your upper back.